Manchester United's Marcus Rashford is expected to be out for a prolonged period of time after being diagnosed with what some people are referring to as a double stress fracture in his lower back. Welcome back everyone to your #1 source for learning about everything related to sports injuries and sports medicine news. In this video, we're going to talk about low back stress fractures, specifically in relation to what's been going on here with Marcus Rashford. Make sure and go subscribe if you like this type of content and want to stay up to date with my future videos, and let's get started. We saw Rashford attempt to play against Wolves earlier in the week for Man United before quickly having to be subbed off after re-aggravating his injury. As he goes in here, we can see him sort of get hit and then twist with his low back, ultimately holding onto that low back and then having to leave the pitch. Henry Winter reported that Rashford had been dealing with a single stress fracture in his low back and now has a double stress fracture and is going to be out for potentially around 3 months. Stress fractures in the low back like this are most often referring to something called a spondylolysis. This is a defect in the vertebrae of the spine called the pars interarticularis. The facet joints in the spine are what allows us to go into flexion and extension, bending forward of the waist and bending backward. They also help to prevent excessive rotation of the spine. So the pars interarticularis is the portion of the vertebral bone between the upper and lower facet joint. A spondylolysis is the most common cause of back pain in an adolescent athlete like Rashford. It's typically the result of repetitive stress located at that section of the bone that ultimately starts off within a stress reaction that can then lead to a stress fracture with repetitive bending and repetitive load. The most common mechanism is repetitive extension of the back, where you can tell you would be loading those facet joints and therefore loading those bones. As the person extends their back backwards, you compress the bone in that area and cause increased stress on that pars interarticularis, which can lead to these stress fractures and the spondylolysis. If we look back at the play here where Rashford had to come off against Wolves, you can tell that while he's not really extending his back all that much, he certainly is rotating his back, which is gonna load those joints and irritate and potentially lead to one of these types of injuries. The best way to think of how these stress fractures occur is to use a paperclip as sort of an example of the bone. If we take a paperclip here and we repetitively bend it back and forth over time from all that different extension and flexion and bending in the spine, you can look at this paperclip and not really tell that there's anything abnormal going on. Maybe if you did an MRI, you could see a stress reaction in here. But eventually, if we keep bending that paperclip back and forth, back and forth, back and forth through hours of play, through practice, whatever the case may be, eventually you can see we lead to a fracture. And so this is what ends up happening when someone has one of these stress fractures. The management for these types of stress fractures is typically non-operative. What we try to do is limit the provoking activity so that we can allow that bone to heal. This means no extension activities or no positions during sports that are going to cause that bone to be stressed even further and potentially lead to an increase in severity of that fracture. And these are usually prolonged absences. It can be really frustrating for the athlete because we have to really limit their play to allow that bone to heal. Now, we heard that this is supposedly a double stress fracture for Rashford, so what might that mean? Each of those vertebrae actually have a pars interarticularis on the left side and the right side. You can have just one side that's involved with a stress reaction, but actually most of the time they're bilateral. Both sides are involved. So when we hear double stress fracture, to me that either means that initially it was just one side of the bone that was involved and now it's the other side of the bone, or instead of being one level of the spine, it's now in 2 levels of the spine. The most common level where we see these is in the 5th lumbar vertebrae because of the excessive amount of extension load at that spot. One of the biggest concerns with these is progression to something we call spondylolisthesis. The listhesis portion of that implies slippage or movement. So spondylolisthesis is whenever you have slippage of one vertebrae in the spine relative to another. This can be either anterior or posterior spondylolisthesis, and you can tell here if you have too much slippage of the bone, you can eventually pinch on the spinal cord or pinch the nerve roots leaving the spine, causing neurologic symptoms. It's whenever we see a severe amount of slippage that this becomes a true surgical type of case. Just a simple stress fracture is not going to be treated with surgery right away unless there's other complications. But if we get to a spot where we see severe slippage of those bones in the spine beyond a certain degree, that's when we have to talk about surgery in order to get that bone back in proper alignment and stabilize the spine. There's certainly always a risk when an athlete has one of these of it getting worse without proper treatment. The key here is diagnosing it early, and they can be really tricky to pick up because oftentimes an x-ray will miss this, and you need to do something like an MRI or a special bone scan to pick up that stress reaction. So during his recovery, the key is going to be rest and limiting the amount of extension on his spine. Therapists will work on core strengthening in his abdomen to limit the amount of load that's on his spine, but a lot of it is just staying away from the activities that could make that fracture worse or lead to progression of something that would be considered unstable and need surgery. That's it for the video, everybody. Thank you as always for watching. I hope you learned something here about stress fractures in the low back and these spondylolysis injuries. Let me know any questions or comments you have below. And until next time, we'll see you later. Bye.